I hope so. Yes. Okay. Bismillahirrahmanirrahim. So, autism. I don't know. When I started preparing this presentation, so some of them are the old slides, some of them are the new slides, and I was just thinking from the examination point of view, what is essential for you people to know. I'm trying to cover as much as possible for autism, the related questions which you people would be able to see in autism in exam, but of course in clinical practice as well. लुट चुके इश्क में एक बार तो फिर इश्क करो, किसको मालूम कि तकदीर संवर भी जाए, शहर जाना से परे भी कई दुनियाएं हैं, है कोई ऐसा मुसाफिर जो इधर भी जाए. Unfortunately, we are just focused on one thing, not too many things, but we have to, as a psychiatrist, make sure that everything should be covered. So, what is autism? Autism spectrum disorders cover five kind of disorders. One is autism, of course, mainstay. Then there is another form which we call Asperger's disease. It's a milder form of autism. Then pervasive developmental disorders not otherwise specified according to DSM, and Rett syndrome, which is unfortunately a very problematic, traumatic, and aggressive kind of a disorder of childhood. Then childhood disintegrative disorders, which is more intense than Rett's as well. Some of the neurological disorders that affects communication, social interaction, behavior, and sensory processing are also included sometimes in these disorders. So they are not actually autism, but they are neurological diseases presenting in a similar form as autism. So that you have to consider as well. And the most pathognomic feature of autism is that when the child is born and child starts talking, communicating, walking at a normal pace, but around the age of 3, symptoms starts appearing. Sometimes a little bit before 3, sometimes before after 3, but on an average around the age of 3. So that is very crucial, that autism is usually onset is at the age of 3. So the parents will definitely convey to you that this child was absolutely fine when he was born. This child was actually talking 2 phrases, sentence. They started babbling. Again, speech was normal, communication was normal, and things were normal. But then suddenly it started deteriorating. That is one of the most crucial point in diagnosis as well. Autism spectrum disorders, they affect the executive functioning, they affect the sensory processing, repetitive behaviors, the motor skills are compromised. Then there is preservation of thought process. So, although the communication is very much compromised and we are not able to elicit the thought process, but in most of the situations, when indirectly the thought process is assessed, it is considered to be okay. Social awareness, sometimes these people do have, and verbal and non-verbal communication is affected a lot. And information processing, of course, is difficult in these children, and it is complicated. We'll go through the details of most of these symptoms. There are 3 levels of autism. Level 1, which requires only the support. So, trouble understanding and following social rules, rigid and inflexible behaviors, some stress during transition, and may benefit from therapy of life skills coaching. Level 2, autism requires substantial support, atypical social behavior like walking away in the middle of the conversation, high interest in specific topics, noticeable distress when faced with change, may need school accommodations like reading help or social skill support. And level 3 is a very severe one, which requires very substantial support. Here, there are communication deficits, there is speech difficulties, behavior problems, and so on and so forth. So it is an intense situation. I hope you people must have watched Forrest Gump, a movie which was actually made about 20 years ago. Tom Hanks was the person, and that was actually showing level one autistic behavior, which required some support, not all of it. But a copy of it was made by Amir Khan last year, and it was again a movie which was said that it is a copy of Forrest Gump, but a good representation of people to understand what actually autism is, which is again something significant. So if you watch the movie and are able to correlate with these things that I am telling you, it will be more helpful. It's basically called a neurological developmental disorder, and it affects number of parts of the brain, including frontal lobes, hippocampus, temporal lobes, amygdala, cerebellum, and whole of this process involving so many parts of the brain compromises lots of things as well. It impacts every functional area of the brain. So unfortunately, because the things are so complicated and lots of areas of the brain are involved, so the things are complicated as well. Usually, the common characteristics, some of the common characteristics, not all of them, they include high level of anxiety. So the child at a new situation is more having problems in integration with the stimuli coming all around him. So if he goes to a new house, new place, new school, anything like that, it's very difficult for him to perceive that this change should be acceptable. So they try to avoid it, and they usually remain isolated. Now, when we say executive function deficits, means there's difficulty in getting started, and once they start, it's difficult for them to end. So if a child is making a puzzle, autistic child is making a puzzle, and if you want to stop him in between, they won't be able to. So they will continue making the puzzle till the time it's complete. It may take hours and hours. Sometimes they are stuck with it and they want to do the task before anything else can be started. So parents can start complaining that once he starts playing with something, he don't want to finish it up until that game is finished. Maintaining attention to the task. So it appears as if they are looking somewhere else and trying to do one thing repeatedly, but their attention span as such would won't be you won't be able to elicit it appropriately, that they are looking at something else and doing something else. They keep on doing it for a longer period of time. Then difficulty in transitioning from one task to another, and disorganization is very common. They have impaired motor control and coordination because of the involvement of the cerebellum. 80% of the people of autism have clinically significant level of motor impairment, which is again, unfortunately, too much compromised. So the all the functions are compromised. 10 most important symptoms of autism for you people to understand when you see a child are: one, there are developmental learning delays. Now, it's a learning delay. It's not, again, associated with other things. So this is important. Then difficulty in communication, single word or no communication. Difficulty in social situations, meeting new people, going to new places, changing the room from one room where they are comfortable. If they are asked to move to another room, they probably will start having situations where the behaviors can be unmanageable. Attachments to unusual interests. So he will start gathering, like one of my client, he was fond of keys, and he's a grown-up man, of course, now, and he has so many keys in his room that there was no space left to even walk inside the room. So he had piles of keys everywhere in the room. Similarly, another of my patients was fond of gathering pampers, diapers. So wherever he was able to see a diaper, he used to pick it up, whether it was dirty or clean. He used to pick it up and start holding it in his room, which was, of course, not acceptable to anybody at home. Why he's gathering the diapers? So He was fixated to diapers and was collecting it. Another of my again client in this situation, of course, he's an adult as well. I don't see children much in Canada, but adults with autism disorders, he has the habits of collecting all the kinds of cars he sees. So he has hordes and hordes of cars with him. Attachment to unusual interest is very significantly there, and that attachment goes beyond again to a point where even the house people, the parents, the siblings, nobody is comfortable with this idea. And difficulty understanding emotions. So when you are shouting, screaming, and trying to tell it to the person, they won't be able to see that you are angry. Or if you are happy and you want to share something, hugging, caressing, making sure that the love is and affection is extended, they won't be able to understand why this is happening to me. So that is again very tricky. So these people, I will explain it later on, they avoid cuddles and they avoid hugging. Most of the children love to do that. So you pick up a child, you try to again hug them, cuddle them, and these children don't like it. Over or under sensitivity to light, sound, and touch or taste, anything. So if he is fond of eating cheese, he will keep on eating cheese and nothing else. Maybe he will be able to eat something else, but most of the time he will prefers to have cheese all the time, which unfortunately again is a problem. Repetitive movements and behaviors. So he will make babbling sounds or strange words coming out of the mouth, and they keep on coming out, despite the fact that the parents try to stop them multiple times. They won't be able to stop themselves. Trouble with transitions, as I mentioned earlier, recurring sleep problems. So most of the time they lie in bed and they keep on lying down in the bed and they are not sleeping actually. Insufficient impulse control. So once something comes out, they want to be like that for long period of time. They prefer to play alone. They have hysteric bouts. So if he's laughing, he will keep on laughing hysterically for a longer period of time. If he's crying, you won't be able to stop the crying, despite all the comfort that you can provide to the child. They may appear depressed, intolerance to sound, which I mentioned earlier as well, hyperactivity, and child doesn't respond to the name. So if his name is Mustafa and you keep calling Mustafa, 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 he probably won't be paying attention to his name. You have to touch and make him move in front of you and tell him that this is what you want, and they will be able to understand. So this is another complicated symptom. They have hyperactivity, sleep problems, playing alone, spin objects. Uh, so they are very fine movements. So one of my autistic child was fond of red backlight of the car. So the backlight, which is red in color, and he used to always go back and stand at the back of the car and looking at that red light in the evenings. And sometimes it was so difficult for the parents to pick him up and make him sit inside the car because he wants to remain there. And there were multiple times when there was some accident about to happen because people don't see the child at the back and they're reversing because he's seeing the red light. So there were incidents. So he was brought actually for this purpose, not because they were concerned that he's having autism. And they don't want to be cuddled, hugged, caressed. So usually when you tap on their head or make sure that you touch their arms, it's usually nice, but they don't like this thing. I hope I'm clear. Okay. At any point, if you feel that you need an explanation, please stop me. So autism spectrum disorders may include, as I mentioned earlier, uh, oppositional defiance disorder, attention deficit disorder, depression, auditory processing, sensory integration disorder. They are gifted at something. So one of the child was very good in mathematics. I hope you people might have seen Rain Man. Rain Man again is movies of late early 80s probably. Dustin Hoffman was the actor in it, and he was able to remember the mathematical calculations very quickly and sharply. So you add up multiple figures, 234,986 plus 982530, and he was able to give you the response immediately. So sometimes these people do have some very remarkable improvement. You must watch these three movies, The Rain Man, The Forest Gump, and the recent movies of Imran Khan. So you will be able to guess out that this is what the autism looks like. Of course, movies are not very typical representations of the actual disorder, but at least you have some idea related to it. Developmental coordination disorders. Most of the autistic people are very obsessional, and that is one of the reasons why the treatment with SSRIs can help them sometimes. Tourette syndrome is very much seen as a comorbid disorder with autism spectrum disorder. Then anxiety, ADHD, specific learning difficulties. All of this spectrum can be seen together in one patient as well. Statistics. Almost 5 times more common among boys, impacts every socioeconomic and cultural population. Previously, it was thought to be more common in low socioeconomic backgrounds, but no, it is seen in all social and cultural background. There is no bar of the economic status. So people with lots of money can have an autistic child, and people with no money can have an autistic child. Half missed and half new cases. Unfortunately, most of the time when the autistic child presents to the pediatricians or the psychiatrist, the diagnosis is missed because we lack something in evaluation process. Children live with autism spectrum disorders are 1 in 68 in general population. So 1 in 68 is a big number. So 1.5 people of every 100 have some autistic tendencies. Maybe not fulfilling the autism criteria directly, but they can have autistic traits. There is a strong genetic linkage, and identical twins, if one child has autism spectrum disorder, then other will be affected about 36 to 95% of the time, which is a high prevalence. So it has a genetic preponderance. A sibling with ASD increases chance by 2 to 18%. So in general population is 1 in 68, more common in males, so 5 males, 1 female, less common in the females, 36 to 95% in the siblings, and 2 to 18% if there is a strong family history of autism in a relative. More often in people with have certain genetic or chromosomal conditions. Here, whenever a person presents with autism spectrum disorder, as I mentioned earlier as well in other presentations, I always go for microarray for genetics because in most of the situation there is some chromosomal abnormality detected as well, which can lead us to better, again, management of the patient so we can make a holistic approach of biopsychosocial model of healthcare and manage them. 10% of children with autism are also identified as having Down syndrome, Fragile X syndrome, tuberous sclerosis, and genetic and chromosomal disorders. So, of 1.5 in out of 100 people presenting with autism, it may not be complete, it could be partial, and of them, 10% will be having some genetic abnormalities. So again, it's a big number. And usually these statistics are asked in exam situation as well. Delayed speech, hyperverbal or nonverbal, difficulties establishing and maintaining back and forth conversations and interactions. So if you ask the name, they may not be able to tell you their name because they are not familiar that this is a social norm, despite the fact that parents keep on telling them to tell the doctor your name, what is your name, okay, your name is Mustafa, your name is Mustafa. Despite that, they won't be able to process it. Inability to initiate an interaction or close appropriately. So entering into the new situation, leaving the situation, say Assalamu alaikum, they won't be able to say that. Say Allah Hafiz, they won't be able to say that. So those things are missing as well. Problems with shared attention or sharing of emotion and interest with others. They won't be able to communicate how they are feeling. And this is the biggest problem. So if they are depressed, they won't be able to express it. If they are having abdominal pain, they won't be able to say that I am having abdominal pain. They keep on crying for long hours because of that abdominal pain, but they won't be able to say. And sometimes this is what is the presentation in the clinics, that this child cries for hours. And when you start looking for it, you won't be able to understand why this child is crying. So, what I usually do, I always involve other people in the management. So, I will come to that in the management as well. I try to engage the pediatrician, audiologist, optometrist, and again, other specialists if needed. So this is a kind of a thing where people have to understand that sometimes child is not able to even tell if he has a pinprick in the foot. He won't be able to tell that there is a pinprick in the foot. He will be keep on crying for hours and hours because the shoe is tight or something is bothering him at the bottom of the toe. So that's confusing. So schedules provide choice and encourage consumer to make their own schedules and choose where it goes, wall, phone. So this is some kind of an help that you can do. So we will try to cover it again once I'll be back with it. And I have mentioned this. Uh, Decrease anxiety in autistic children. So we have to teach them, calm them, relaxation exercises, breathing exercises, scripts, practices, role plays, create concrete visual schedules, provide a copy to them. Any changes in the schedules, they should be known to them. Warning before any transition. If tomorrow you have to go to see your brother, then you have to keep telling it to the child 24 hours before going to the brother's place that tomorrow we'll be going to see your uncle. Tomorrow you'll be going to see your uncle, so that sometimes in 24 hours he will be able to register, okay, fine, I'll be going to my uncle's place tomorrow. So that is very important for the parents to understand. Give very specific directions to prepare for a transition. So you have to try to tell them that at 8 a.m. you will be having a breakfast. At 8:30 you will be sitting in a car. At 8:45, 8:35 the car will start and you will start going towards the school. At 9 o'clock you will be reaching at the school. At 2 past 9 you will be getting out of the car and getting enter into the school. At 5 past 9 you will be entering in your class. At 10 past 9 the teacher will come in and start teaching you. So many details you have to tell them. And if the verbal communication is a problem, then it has to be shown with the pictures that this is about to happen to you in next 2 hours time. So they are prepared. And once that routine is established, they know what is coming next and they'll be less anxious, less troublesome, and having more of the interaction. Hyper or hypoactivity to sensory input or unusual interest in sensory aspects of the environment. So maybe adversely highly stimulated by noises, lights, textures, sound, taste, and even pressure. So if they are wearing a shoe, the pressure of the shoe can make them uncomfortable. Or if they are wearing a shirt, the pressure of that warm jacket on their body can make them cry as well. So these are very small things, but we have to take care of them. मैंने कहा खराब हूँ गर्दिशे चश्मे मस्त से उसने कहा रक्स कर सारा जहां खराब है. Unfortunately, teaching relaxation, as I mentioned to you, some of the strategies, some very small things that probably you won't be able to understand, you have to tell them. And it's easier for them to learn if those things are repeated over the period of days, months, and years. So going to the school maybe first 8 to 10 months will be difficult for him because he won't be able to understand the schedule. Sometimes dad is getting late. Sometimes the car was not starting. Sometimes there was too much traffic on the road and you were late. And these things, they do bother children with autism. So absolute fixation to absolute routine is the best way to move forward with people in autism. And that is what is most important. The rest of it, again, uh, trying to tell them that you like them, presenting each thing every time, calming down words, trying to teach them breathing exercise. Of course, these are difficult things to be done, but they can be practiced to reduce their anxiety symptoms. Now, there is autism which is restricted type or repetitive type. So, two types. As I mentioned earlier, there are further different kinds of autism. So, one of the type is restricted and repetitive. Restricted or repetitive means that stereotyped repetitive speech, motor movements, or use of objects, ritualized verbal and non-verbal behaviors, highly restricted interests that are abnormal in intensity and focus. Some of these things are repeated in the presentation, so I am trying to skip most of the things which are I'm repeating. Social stories. So this is another way to assess a child by giving them some comic books with big pictures on it, with the simple things on it, so they are able to understand the stories that this is meet and greet. So dad and mom meeting uncle, and this is you are meeting your uncle, how you will be meeting your uncle, how you will be meeting a doctor. So these pictures and other things can help them as well. Comic strip conversation are very helpful. It's a technology, as I briefly mentioned to you. The technique, that is the technique that can be individualized according to the person, according to the situation. सितम तो ये है कि वो भी ना बन सका अपना, कबूल हमने किए जिसके गम खुशी की तरह. What is autism? Other characteristics: avoidance issues, isolation issues, executive functions, I have already told you, impaired motor coordination, I have just covered it as well. Autism parenting is, of course, a very, very difficult task, and most of these parents they burn out after a few years of taking care of their child. So, lots of emphasis is given to make sure that the parents of an autistic child are supported well. They have break times, they should have other supports, other family members who are familiar with the child, who will be able to help, extend, and not one parent is enough for the child to manage 24/7. It has to be both the parents, and if they have other siblings, they should be engaged as well. So the outcome is relatively better. Most of these people then are restricted in eating as well, so they are very choosy. One of my autistic again person was preferring always these Doritos kind of a stuff. So he was eating them a lot. And of course, the consequences, there are nutritional deficiencies, and then there is weight gain as well. So most of these people do have problems with the weight because they don't want to understand that this is a healthy meal or this is an unhealthy meal. Once you give them that specific thing, and if they like it, they will keep on taking it for the time being. So this is very, very important in the beginning of the management of the autism, that the parents should be told that these are the things that should be given to the child, the healthy choices, the fruits, the vegetables, the meat, not the unhealthy items. But parents feel that, of course, because he's a child, so he prefers to have an ice cream. And once you give an ice cream, he will be hooked onto the ice cream. So he won't take any other food but just the ice cream. So that's is very careful. Then they're very choosy about the clothes and the things they take over them. So if they are using one kind of a sheet over them, or again or any comforter that they like, They start using it. For 5 years, they are using it, and mom is not able to wash it even. Because if she'll wash it and if it's dry, not dry, the child won't be able to sleep at night. So make sure that right from the beginning, these children should have the habit of using at least 2 to 3 things over them over the different days, so they get used to it, so that parents have the capability of changing them, washing them, or making them understand. So even a slight change in their routine, like a comforter that they were using to sleep at night was changed, the child may create havoc in the house, and the parents will be in big trouble. 80% have sleep problems and medical issues as well. Mental health problems are very common in autistic children, and lots of them require psychiatric input as well, as far as the biological treatment is concerned. So they do the rote learning. They are good in repeating. They easily able to again pick one thing and then stick to it for the rest of their lives, which is again unfortunately a problem. They have exceptional, precise, detail oriented, and they can be extremely focused as well. So we have to be careful. Now, diagnosis of autism. So some of these symptoms and signs that I have explained to you and given you some hints of how the parents should be able to make sure that the things are streamlined in the life of a child. Not everything. I am not able to cover everything, but I will try to cover other areas as well. So, what should be done as autism diagnostic assessment? This is again very crucial to and most important component. Whenever you see a child with autism or suspected autism, one thing you have to take developmental history, medical history, family history, and social history. You have to take the information from the school, childcare, community, audiology, vision assessment is very, very essential in these children. All the autistic children should have audiometric assessment and the visual assessment by optometrist. Direct clinical observation of the child is essential, and autism spectrum diagnostic tools, which we will tell you in short time, I will tell you in short time, are important as well. Always discuss these things with the parents and the families to support them. They should be given one-on-one care if the psychological or the behavioral approach is required. They cannot be adjusted in a whole class or in people, say 10 people in a class or 5 people in a class. It has to be individualized treatment. I know that it is very expensive, and that's the reason why in most of the places across the globe, it's not provided. Ideally speaking, it should be the one. So people who can afford it, they should have one-on-one person who will be able to take care of that child. And family support services should be available. As I mentioned, that the parents gets exhausted, then they stop doing the things that they were doing, and things are usually complicated because child won't be able to accept it. Gather additional information from different places, discuss the results, write a report, and refer for appropriate management strategy and the plan. This is important. And if there is a need, you can go for further testing, like I said, microarray for genetics, psychological testing with appropriate diagnostic tool, and other interventional strategies. So this is very, very important. Now, screening tools. There are some of the screening tools which are available on the net, so you can get them. But these screening tools are just a way to move forward. They are not the diagnostic tools which can confirm the diagnosis. They are just actually the screening tools like MCHAT. MCHAT is modified checklist of autism in toddlers. SCQ, Social Communication Questionnaire for more than 4 years of age. STAT, screening tool for autism in toddlers and young children. Then screening tools for the development could be ESAC, Early Screening for Autism and Communication Disorders, Infant Toddler Checklist, SWYC or POSI, Survey of Well-being of Young Children, Parents' Observation of Social Interactions. Now, most of these scales are just to identify the important significant features in that child. They are not diagnostic tools. They are just the screening tools. So you may make a mistake in diagnosing if you are just using the screening tools. Like in Pakistan, I know that most of the psychologists use CARS, which is just a screening tool for autism. It's not a diagnostic tool. So CARS is not very having good sensitivity and specificity to diagnose it. So basic theme is that autism spectrum disorder, primary level 1, a screening questionnaire should be given. Developmental surveillance is required. ASD specific secondary screeners like RITA or STAT should be given. Then health plan of school, behavioral strategies, diagnostic reports should be maintained. The most important tool for the diagnosis of autism is ADOS, ADOS, ADOS. ADOS is a kind of the tool which is unfortunately a lengthier one. It can be administered to all verbal and non-verbal people. It requires a very specific training. These days, I think ADOS 3 is the tool which is, again, updated version of ADOS. Up to last year, I know that ADOS 2 was there, and somebody said that ADOS 3 is in the market. I don't know. I'm not sure about it. But ADOS is the tool which is a diagnostic tool for autism. ADOS. ADOS. And ADOS stands for Autism Diagnostic Observation Schedule. Autism Diagnostic Observation Schedule. It's a big booklet. So it's basically a series of booklets that needs to be covered by a trained person, a psychologist preferably, who would be able to administer it and then see it. I remember one of my seniors was trying to get the rights for ADOS. It's a very expensive tool. I think it costs around $10,000. And they were trying to get the rights for it to translate and validate it in Urdu. I don't think so they were successful. I don't think so ADOS 2 is available in Urdu language, but it's available in English. But it is a good tool for diagnostic purposes. Now, what happens to the brain and the nervous system in autism? Some of these things, they are not proven by the fact. The evidence is lacking, but most of these things they do ask in the exam situation. Like one of my child, when I was seeing him and as suffering from autism, he was seeing a nutritionist and he was given at least 11 different kinds of multivitamins, including omega-3 fatty acids. If the child is just 4 years of age, his kidneys, livers, and other vital organs are important as well. And if we are loading him with such irregular medications like multivitamins because they can help him improve, then I think it's taking a chance on long-term prognosis and outcomes. So there is no evidence that omega-3 fatty acids, multivitamin, minerals, and nutritional supplements can help autism. But of course, some people do try it. So there is mitochondrial dysfunction, which can be helped with these things in improving autism. Then there is chronic neuroinflammation, increased cytokines in system. It is proven again with lots of data, not again 100% confirmed. Nothing is 100% confirmed. But lots of data related to chronic neuroinflammation, increased cytokines, and anti-inflammatory agents can help these kind of children as well. But this is again not proven facts. There are data related to it. Then some people say that there is disturbance of oxidative stress and antioxidants can help these people. Then dysregulation of monoaminergic neurotransmission, SSRIs can help it. People who are presenting more of obsessional anxiety type of symptoms, SSRIs may help. But again, may help, not significant data available to prove its efficacy. Antipsychotic medications are usually given sometimes to these children to keep them calmer rather than using benzodiazepines to address the issues. Then glutamate GABAergic imbalance is suggested in lots of studies, and they say that anticonvulsants and glutamate antagonists and psycho anti-stimulants can help as well. Then there are hormonal imbalances, so secretin, melatonin, oxytocins are tried in autism as well. There is a data available for immune dysregulation, and sometimes immunomodulators can help these people. Environmental toxin and stressors, lots of research was done on this about 10 years ago, and then people started using chelating agents, anti-stress drugs, and other non-pharmacological treatments for it. Uh, Again, not too much convincing data related to it. So autism affects the whole of the brain, and then there is a problem in attention because of processing in the midbrain. Visual processing is compromised, affecting the occipital lobes. Auditory processing can be compromised because of the temporal lobe involvement. Comprehension is jeopardized because of the temporal lobe involvement. Long-term memory can be affected. Working memory can be affected. Logical reasoning, all because of the limbic system. And planning may be compromised. Processing speed can be compromised. So they say that autism is on the rise. Back in 1970s, it was considered that autistic children are seen 1 in 2,500. 2020 data suggests 1 in 54. I mentioned to you 1 in 65, which was somewhere between 2008 and 2018. Now the statistics are increasing, 1 in 44. 1 in 44 is quite a big number. So this means every third child is having some autistic tendencies in general population, which is a big, big number. So we have to start taking care of it, understanding it, because unfortunately we'll be missing it. So there is an unusual rapid growth in infancy and early childhood, atypical patterns of connectivity in autistic brain. So if you can see the pictures, different pictures. So they say that the prunation and the neurogenesis process is abnormal, and there are possibilities that this is causing autism. So this is again not proven with the fact. The PET scans in autistic child shows STS abnormalities, which is gray matter decrease in some of the areas of the limbic lobes, which can be a cause of autism. Then there is further refinement into it, that there is neuronal activity is compromised, and these terms probably they may come up in the in one of the MCQs. Synaptic pruning, synapses morphogenesis, synaptic transmission, synaptic plasticity. In autism, all of these four processes are affected. Pruning means migration and morphogenesis, transformation of the neurons, transmission and plasticity, regeneration of the neurons. So neurogenesis, neuronal migration, cortical lamination, and circuit formation. These are some of other words. Synaptic functions are compromised. WNT signaling is compromised, which includes FMRP, MECP2. I am not very much familiar with these terms, so I won't be able to explain it to you. But MCQ regarding what happens in autism: synaptic pruning is compromised, synaptic morphogenesis is compromised, synaptic transmission is compromised, plasticity is compromised, cortical lamination is compromised, RNA stability and splicing is compromised as well. And there is synaptic translation rate is compromised with synaptic translation. So these things are very much now in progress. So maybe in 5 years from now, we'll be able to understand all of these terms when things will be in the market more. So ASD symptoms, like the previous slide, if I explain it here, people say that there are environmental factors and prenatal factors like viral infections, parental age, zinc deficiencies, which can lead to abnormal fetal development, germ cell mutation, and fetal brain development dysfunction. Then there are epigenetic factors, DNA methylation, histone modification, and microRNA, which leads to all these chemical processes leading to ASD symptoms. And then genetic factors, of course, chromosomal abnormalities, point mutations, translocations, and copy variants, which can lead to some other processes, chemical processes in the brain, leading to ASD symptoms. All of these symptoms are related to, again, neurochemical and neuroconnectivity of the brain. And this is important. दिल ने तेरे फराक में कर ली है खुदकशी और आंखें तेरे दीदार के फाकों से मर गईं. This is what happens in psychiatry most of the time. Strength is that autistic people could be good people, very nice, humble, polite, obsessive. They may be very good mathematicians, philosophers, talkative as well. Mild autism, people do wonders. If you see Rain Man, you'll be able to understand. But problems with autism is that we are still not able to understand the precise etiology of the disorder in autism. There is lots and lots of research happening around for genetics of autism, for chromosomal transmission of the autism, for other abnormalities, but nothing conclusive is still in the picture. In the end, I will say that if you have one person with autism, you met with one person with autism. Like in schizophrenia, if you see one schizophrenia, you'll be able to understand schizophrenia and you'll be able to understand the psychopathology. Here, if you have met one autistic, this means that this is just one autistic. You won't be able to understand the whole of the autism. कुछ तो है जो तुझे मुमताज करे औरों से, जान लेने का हुनर हो के मसीहाई हो. Thank you very much. Any question now? No question. सब समझ आ गई या कुछ समझ नहीं आई? Okay, go ahead, Manu.
सर वन क्वेश्चन सर, मेरा एक क्वेश्चन है, पता नहीं शायद सिंपल सा लगे आपको, बट मेरे लिए बहुत इम्पोर्टेंट है. जब हमारे पास पेशेंट्स प्रेजेंट करते हैं ओपीडी में और अगर हमें लगे कि इनको ऑटिज्म है, अगर हम सस्पेक्ट करें, मतलब ये हमारे टीचिंग हॉस्पिटल्स की बात कर रही हूँ, तो ज़्यादातर आई एम ऑलवेज कंफ्यूज्ड कि पेशेंट के पेरेंट्स को कैसे इंफॉर्मेशनल केयर देनी है इसको लेके. और मुझे लगता है कि यहाँ पे हमने कब ये सोचना है कि यहाँ पे मेडिसिन का रोल कब आएगा इसमें, और हमने सबसे पहले पेरेंट्स को समझाना कैसे है कि ये क्या चीज़ है, उसके बाद इसमें साइकोलॉजिस्ट का कितना रोल है, और मेडिसिन किस पॉइंट पे किक इन करती है. मेडिसिन का कोई रोल हो सकता है, जैसे हमारे कंट्रीज में वो साइकोलॉजिस्ट का सिस्टम बहुत ज़्यादा वेल एस्टैब्लिश नहीं है, तो इसमें क्या ये हो सकता है कि हम मेडिसिन से उस कमी को थोड़ा-सा पूरा कर सकें? पता नहीं इफ माय क्वेश्चन मेक्स सेंस और नो.
एक क्वेश्चन तो नहीं है, ये तो 5-6 क्वेश्चन पूछ लिया आपने एक वक्त में. अच्छा, ओके. सबसे पहले कि ये कि पेरेंट्स को कैसे बनाना है. सो द बेस्ट पॉसिबल ऑप्शन टू कम्युनिकेट, यस, द गुड डॉक्टर इज, उस सीरीज का नाम है द गुड डॉक्टर. Yes, The Good Doctor is a very good, again, serial where an autistic guy becomes a doctor and he's treating people with lots of empathy and care. So that is one of the series. Yes, you would be able to understand that high functioning autism people can definitely be there as well. So this means that if we are not able to diagnose autism in some of the people around us who are doctors, even engineers or somebody else, uh, probably they were never assessed for autism, but they were having autism because they were very obsessional, particular. blah blah blah, जो चीजें मैंने सारी बोली. How to present this information to the parents? The first and the foremost thing is to share empathy and care and the support. The support is the key. So you have to make them understand that this child is unmanageable for you by yourself, and mother alone cannot manage it. So the father has to take some responsibilities. So there should be hours of care in a patient, in a child. So 6 hours for mother, maybe 4 hours for the father, and maybe 3 hours for somebody else, a care provider, a maid, a nurse, or some trained person who would be able to take care of the child. And if the child develops this social interaction, then it will be better. Second, you have to tell it to the patient that the conclusive diagnosis of autism will never be possible in a short period of time. So it may take some time. So you have to make sure that you make the parents understand that you will try to do everything to assess and intervene. Go one step furthermore. And then you have to make sure that the parents understand that assessing the child like this won't be an easy task for anyone, even for the doctors. So you will involve, again, as I said, informational care mein, you have to make sure that the parents understand that this is a kind of a disorder which can be in autism spectrum disorder, but you need time to confirm the diagnosis and other people will be involved in it. So that's psychoeducation with the family members. And then you have to tell them the process of evaluation, which will be including other specialty people, psychological testing, psychometric assessment, and your own observation with lots of details, which I talked about. Parents से बात करनी है, टीचर से बात करनी है, फैमिली से बात करनी है, फैमिली हिस्ट्री लेनी है, सपोर्ट सिस्टम देखना है. So उसकी evaluation में you need time. So you have to communicate this to the parents. How much is the role of the psychologist? Of course, there is a huge role of psychologists in taking care of these people, but most of the psychologists, they don't want to spend too much time on a autistic child because outcome and prognosis is compromised as well. So the psychologists try to make them, educate them, tell them, and then try to shift the responsibility to some other people, which is not a bad option. So we should try to focus more on behavior therapists, counselors, and support team workers to be more engaged by educating them rather than asking the psychologist to take charge of everything. So you have to involve the psychologist as far as the psychoeducation is concerned, the diagnostic interpretation is concerned, report writing is concerned, and some of these things are concerned. But of course, you have to engage other support team workers like counselor, behavior therapists, and other people who are not actually psychologists but ancillary staff around you. That is the main purpose. And then involve other audiologists, pediatrician, optometrist, physicians to make sure that a child is taken care of. Go for basic investigations, all of them, like MRI or EEG or blood work, so that you don't miss anything. Because these people won't be able to tell you that my ear is aching or my head, I have a headache, and that's the reason why I'm crying. So you should go for the investigations. ये तो आपका वो सवाल था कि साइकोलॉजिस्ट को कैसे इन्वॉल्व करें और इंफॉर्मेशनल केयर पेशेंट्स को कैसे देनी है. बी वेरी ट्रूथफुल एंड ऑनेस्ट with the family. If you don't understand, tell it to the family that I will need some time to understand the child, making the final conclusive diagnosis, and I will definitely give it to you in writing when my confirmation is there. So be honest with them and don't label immediately unless or until you are sure about what needs to be done. ये दो कंपोनेंट्स हो गए. और क्या सवाल था? दवाई. Okay, yes. So medication involvement can always be there or should always not be there. Like if you see that comorbidities are very high in autism. So if the child is having a seizure or he is having high anxiety and you feel that the support that you have to reduce the anxiety, to teach the child will take a long period of time, so we can start anti-anxiety drugs. If the child is very obsessive, anti-obsessional drugs can help the children. You can always start an SSRI, go slow, push up the dose to an appropriate level where maybe the anxiety and obsessional symptoms can be addressed. If there is too much of aggression, yes, some antipsychotic medications can be used to control the aggression. Anticonvulsants can be used to calm him down. But always think in the long run that if you have to give this medications for 5 years, 10 years, do you think it's inappropriate? So giving a benzodiazepine to a child for aggression or anxiety, I won't recommend it. Of course, I will definitely say that don't do that. Make sure that whatever medication you are giving to him is to control the symptoms and help the parents and the child to stay comfortable. Not to give medication to treat autism, because autism won't be treated with medication. Our target is to improve the quality of life of a child and the parents. Our target cannot be to treat autism with psychometric medication, antipsychotic or psychotropic medications. So make sure that you understand this. If you'll be able to understand this, that you want to just improve the quality of life, you want to help the parents, you want to make sure the child is comfortable, then of course you won't overprescribe the medication. As I gave you the example, the nutritionist was giving 11 multivitamins to a child, and I shut them off, all of them, because there is no conclusive evidence that it can help. So, role of psychiatrist is important in making sure that as a team, you should make sure that all the domains are covered: psychological, behavioral, psychometric, physical, social, so all of it. And then you should be playing a pivotal role in maneuvering all the aspects. If he needs a optometrist, he needs an audiologist, if he needs a EEG, if he needs any other supports, you should be there to help it out. And it's an ongoing process. It never stops. If your repo understanding is better with the parents, then you can help the child more. Most of the time, because we are not communicating much with the parents and not giving them help and support and honest with them, most of the people leave. And then they don't ever come back to you. So they are in the hands of people who probably start minting money out of them, which won't be a good option, honestly speaking. I hope I have responded to your question, right?
Yes, sir. In very
Okay.
detail. Thank you so much.
Okay. Any other question? None? Good. I thought it will be a lengthier presentation, but it is just an hour, which is good. There is a conference in Karachi. All of you can attend that. WPA Karachi wale wahan chale jaएं. We'll be having a symposium in Lahore with all the people who are international speakers who will be coming to Pakistan to attend WPA Thematic Congress in Lahore on 7th of March. And all of you are welcome to attend that as well. So best of luck. Hope to see you soon again. Allah Hafiz. If there will be any questions, just text me. There was something in the chat box. I'll just check it out, and you can go if there is no question. And there is okay, yeah. So nothing significant in the chat box that I should be responding to it. But yes, good points. Okay, take care. Allah Hafiz.
Allah Hafiz. Thank you, sir.